Hello, everyone. Welcome to the Community Rec Magazine Virtual Roundtable, sponsored by Lebert Fitness. Today, we're discussing how to set your facility up for success in the midst of a coronavirus case resurgence in the U.S. I'm Bobby Dyer, the editor of Community Rec Magazine, and I'll be today's moderator. We have a great lineup of panelists for you, three familiar faces, all representing different regions of the country and dealing with different state and county guidelines on opening and operating procedures. Today we have Chris Toynton, the president and CEO of the YMCA of Greater Omaha in Omaha, Nebraska. We have Art Kruger, the director of the Wave Aquatic and Fitness Center in Whitefish, Montana. And we have Todd Rockoff, the president and CEO of the Tucson JCC in Tucson, Arizona. So here's how the roundtable will go if you haven't been here before. We'll spend roughly 30 minutes doing a moderated Q&A, and then we'll open up the floor for questions from you, the audience. So listeners, please submit your questions as you come up with them on the GoToWebinar control panel. We'll take as much time as we can to answer as many questions as we can over that last half hour or so. We probably won't be able to get to everyone's questions, but I'll do my best to get to as many as possible. So now we're going to dive in. Chris, I'll start with you. I didn't tell you that before we went live, but surprise, you get to go first. So the nation is seeing a resurgence in COVID-19 cases, and some states are even reporting their highest daily case number since the pandemic started within the past couple of weeks. And as a result, community rec facilities everywhere are having to adjust to decision makers and policymakers' reactions to this spike. So at the Omaha YMCA, have you had to adjust your operating procedures based on changing state and or county guidelines? And this can include cleanliness, safety, distancing procedures, having to change your hours, restricting certain programs, anything that has to do with your facility.
Yeah, Bobby, we've been pretty fortunate in that things continue to progress positively in both Nebraska and Iowa's a little touch and go where we operate in both states. So we've been fortunate enough that in Nebraska, things continue to get a little bit better and a little bit better. There is some concern that this next wave is going to hit us and we're going to have to peel back. One of the things that we're doing to try to be great stewards of health is to set good examples and to really coach our staff and our members. It's important that we as a society support and help and try to stop this spread, because if we do get shut down again, if the spread gets bad again, operations are going to be really challenging for all of us and for us to continue. So we're trying to do our best to keep the facilities clean, keep people spread out, support the needs of the government to keep people focused on health and safety guidelines. And then in parallel to that, we're planning internally how we run our business and how we structure our business if the restrictions come back and we're not able to operate normally.
Okay, excellent. Art, same question.
Well, I think it would parallel what Chris has going on in terms of what we're doing here. We of course had our initial shutdown and were able to reopen right around Memorial Day. And we have all of those social distancing requirements in place. We've increased the amount of cleaning, sanitization that we've done. We've doubled that essentially, which I think is a great and important operational change. I think all of us has probably increased that quite substantially. We at one point here several weeks ago initiated our own mask order with our facility. We're actually one of the only businesses in the state of Montana who initially set that in place, and then soon after that we had a state mandate by our governor to wear masks in public. The one exception, or one of the few exceptions for that, is of course when you're exercising or swimming you can't wear a mask, so that, thank goodness, is in place. So as Chris said, I think it's extremely important to make sure that you are being a steward of those initiatives, because we are, after all, trying to improve the health and well-being of our communities. And we've exemplified that, I think, from our staffing situation, and we've encouraged our members to do the same thing. And it is challenging with members to ask that they're compliant with those, because I think we have a lot of different perceptions of what should be done, but that's another conversation. So those are some of the things that we've been doing.
Great. And Todd?
So we opened up on June 1st with our fitness center, our pool, our tennis center, early childhood, and summer camp. The cases in Arizona, as it's no secret, after Memorial, they really skyrocketed. And we're seeing, record number of cases. And as a precaution to that, the governor did close all fitness facilities at the end of June for 30 days. So we closed our fitness center, but have kept our aquatic center open, our tennis center, summer camp, and early childhood education. And we have put in mountains of new protocols for the way in which people access and egress the facility. We've actually created 2 separate entry points, one for the children's programs and one for the aquatic and tennis center, so that we're not crossing populations. We've certainly doubled our efforts in cleaning and sanitization. Our staff are all required in public areas to be in masks when working with the public, and the public is required to wear a mask unless, of course, they're swimming and playing tennis. We felt was physically distanced enough that a mask would not be required there. We do not have our children in masks in the program, and that was a long discussion, and we landed on that, and I think it was the right thing for our summer program. So we are continually evaluating and reevaluating our protocol to ensure that we're able to be open and open safely, so that we can adjust to whatever's happening outside of us, recognizing that right now we have not flattened the curve. We've actually expanded it at the moment, or the city has.
Right. Well, Todd, I actually want to stay with you. So how are you communicating to your members all of these mountains of protocols that you've described? New hours, restricted programs, different areas of the facility being closed, et cetera. What measures are you taking to make sure members know exactly what's going on?
Well, we're doing a couple of things, Bobby. One is, as we reopened, we published our 40-page document of all of our different protocols to let people know. We put a video together to show people how they could access the facility, where they needed to park, how they could get in, and all the different pieces that would affect them in the way in which they're used to accessing it. We have had a number of cases where a staff person or someone related to a staff person living with them has had a positive test. And we've had to close a classroom or a camp group for 2 weeks as part of our protocol. And we have transparently shared that with the entire membership, so that everyone knows what is going on. At least our feeling was, the more open we could be, then the less people are going to think we're hiding something, or there's something that they should be worried about. So we have certainly significantly increased the volume of email. Every 2 weeks, I'm going on a public Zoom with our members and allowing people just to join, so they can ask questions, give me suggestions, certainly give feedback as they want to. But we want to be able to be out there so that people know that we're concerned about our community, and their input and advice and reaction is important to us, and we can learn along with them, because there was not a playbook that we had in our back shelf about how to deal with a pandemic. So we're all doing this together.
Chris, can you jump in on this? What measures are you guys taking as far as communication?
Yeah, I think this is one of the areas that we've found has had to change the most. We wanted to be as open and as early as possible, telling members what was coming in the days and weeks ahead. And so we were trying to be 2 weeks out in front of it, but things changed so fast that we were having to backtrack on what we said we were going to do. So we've turned to proactive communication only when we make a change. So we're not necessarily communicating ahead of time when a service is becoming back online. We're just telling them when that service is ready. For example, we added open swimming this week. And so we sent a letter out saying, here's what we're doing for open swimming. Here's how here's how you can register. Here's how you can reserve your time. Here's just the information about open swimming, and everything else continues to be available to you. So we communicate almost daily now what's going on and as it goes, because it's been tough for everybody to get communicated to and then see a change, and everything just evolves and moves so fast this day and age that we've changed the way we communicate. And we don't want people to get lost in the communication train. If we're over communicating as much as we want to do that, then we start losing them as well. So trying to find different mediums too. Most of the time people are focused on social media, but we have a wide range, just as everybody does here, from seniors to youth and everything in between. And so we need to make sure that we meet them where they are, communication. And it's been a moving target. So we've been trying really hard to keep up with that. And I love what Todd's talking about doing. And I think those are great ideas for all of us to take and learn from.
Yeah, definitely. Art, can you jump in on this?
Yeah, I don't know that I would have much more to add in terms of how we're communicating. I think digitally, we're using all the resources that we have. We have not done the digital Zoom. I'd be interested to hear Todd tell us how that's going. That would be interesting. But we too see a wide demographic of our membership, particularly those that are elderly, don't use a lot of these social media platforms and have a little more difficult time with emails and that, and we haven't done a lot of print. So that's the one area we have personally struggled here in our facility. But yeah, the idea of doing videos of how to upon reopening, I think were very popular. We too did that, and you know, displayed and role played what it would be like to get out of the vehicle, to get in the facility, how to use the facility with all the equipment spaced and that. So that was really one of our more popular efforts there. And something that Chris said in terms of over communicating, we found ourselves, potentially doing that as well. So we try to give updates real time on our website as much as we can. So that's one thing that's worked well for us.
Excellent. And Art, I actually want to stay with you, and I wanted to talk about something that you had actually mentioned before we went live, that the Wave implemented a mask wearing requirement in the facility. You mentioned that your organization was one of the few businesses in Whitefish, Montana to do so. Did you find that affected any of the membership participation, or was there any sort of pushback from the community at large over that decision?
Yeah, well, we were one of the first businesses in our state really to initiate a mask order, and to say that I had trepidation going into that might not be enough. It was one of those things where we didn't know what kind of response we were going to get. We certainly made the decision as an organization because we believe that it was an effective or is an effective method to help flatten the curve. And there was certainly a few of our members who did not agree with that. It put our staff in a position to be the police at times, and we tried to give them the tools necessary to role play and to practice those conversations ahead of time, and to get a manager or myself in the position once that conversation got to a point where it was going to be difficult. And so one of the persons on my roundtable owns a facility in Houston, and he had given me encouragement because he had 8 or 10 days of some difficult conversations with his membership. But once that first initial period had gotten over, he saw an increase in his usage because people felt safer. And we actually trended that way as well. So our usage increased, not substantially, but our usage did increase. We did see some cancellations, and some holds because of it, of course. And then not too long after that, our state governor Bullock, actually put a mandate in for the state of Montana for masks in public. But it was a bit of a rocky road, but we saw an increase in usage actually, which is great.
Excellent. So And I guess, Chris, we can go to you for this one. In thinking about how the community reacted eventually to the decision in Whitefish to wear masks, have there been any ways you've been emphasizing the importance of your organization's services and the safety that members can experience being there in the community?
Yeah, I think Art has it right in place where it was all about education and making sure that we showed people the level of comfort that they could have at the YMCA. And so videos were very helpful, especially early on. I think things right now, because they're so potentially volatile and politics are at play, and our organizations are usually try to be as least political as possible. I think it's really comes down to what can we do with our organization to set the example. So we've distinguished between the ability to spread equipment out and really articulate and help people understand how many people are in the building. So you can check our app and our website at any one point in time and know what our capacity is. So if you're uncomfortable coming in because of crowds, you can wait till the check-in numbers are significantly lower, and you can get a sense for how that's taking place. We also then set the example as individuals. So our staff are all in masks and in gloves where appropriate. We're doing a lot of community activities. We've understood that we're not just a gym and swim. We're out in the community. We're understanding what the needs are. We've given away 200,000 pounds of fresh produce to people in need. Every day in June and July, we've been at a school giving fresh produce out, and we're partnering with community agencies. South Omaha is one of the hardest hit COVID areas in Nebraska, and we're there. So not only giving that food out, and we're creating lines and people who are very interested, but masks aren't prevalent there. So we partnered up with the University of Nebraska Med Center, and they handed out masks. So everyone who got a box of produce also got a mask, and every kid that was in that car, we helped them. We had masks on. They got pretty flowers and different designs on them. The kids got really excited about being able to put them on. So we think that's a really good way to just set the example. We're not telling them you have to wear a mask in order to get fruit. We're saying, hey, look at this great opportunity. You get fruit, you get a mask, the kids get excited. Those are kinds of ways that we can make a difference and influence people without being political, without pushing one person's agenda on everybody. And I think that's been really helpful.
Yeah, and actually, I had a follow-up question to that. Have you done any sort of advocating on behalf of your facility to policymakers in the area? And I asked that because our sister brand, Club Solutions, that's been a hot topic among health club operators and owners, trying to communicate to the local decision makers that health and wellness facilities are important, and likewise, community rec facilities are very important. Services you provide are critical. Have you been communicating that at all to decision makers?
Yes, we've been really driving hard, and not necessarily on the fitness side of things. We have childcare centers that have been operating since day one, never closed down, really focused on essential personnel. We've been providing food. We're really doing a lot of hard work. We were not eligible for PPP loans from the Small Business Association because we have many employees. So we're doing a lot of advocacy work to get organizations like ours supported. We're also doing a lot of advocacy work on behalf of childcare providers. The number of childcare providers that have closed during COVID is horrifically high, and it's going to create a major strain on the economy if we can't bring back the right number of childcare agencies and we can't keep them financially whole. The margins on childcare, even if you're a for-profit childcare provider, are very, very minuscule. And so we've been doing a lot of push with the state to make sure that CARES Act money that flows from the federal government to the state can help childcare providers, can help keep the economy going by making sure that we have these things. We're also helping on the school front. As people go back to school, there's a massive need. If they can only go virtually, and parents have to go to work, there's going to need to be a solution, and that solution is not inexpensive. So we're doing a lot of that work, talking with our senators and our congressmen and women to really help the industry, because this is square one. This is ground zero. We need to make sure that people have a place for their kids to go, to be safe, to be educated, in order for them to go to work and to be productive in society.
Yeah, Todd, how is the Tucson JCC emphasizing its importance in the community?
A number of different ways. We worked with our county and got a grant that allowed us to make meals for 3 different apartment complexes that are residences for seniors and operated by Catholic Community Services. So we're serving 650 meals a week, and that's really for people who are shut in and stuck where they are. It's nice to know they can get a fresh meal every day, and we're honored to be a part of that. We've held a number of blood drives with the Red Cross Bloodmobile in our parking lot, and it's amazing how those fill up. As soon as we publicize that it's available, the community comes right out to sign up, and that's really wonderful because it's so important now that's available to people. Additionally, we actually had the good fortune this week of all 3 TV stations here coming to cover the J in terms of the services that we're providing, how we're staying open, how we're staying safe. So a little bit to tell our story, that they felt that it was what we're doing and how we're doing it is of greater community benefit. So we're hoping that that helps us get the word out to people in terms of what the J is doing here in our community for the people that live here.
Definitely, that's a big deal. Every TV station in town, Todd, they're covering this roundtable, right?
Oh, I'm sure.
Actually, have you likewise to what I asked Chris, have you been speaking with any, policymakers or decision makers in the Tucson area, just trying to communicate the importance of what the Tucson J does?
I would say in an informal conversation way. We've not been doing direct advocacy. We did call the governor's office directly when the fitness centers were closed down, just to get clarity on what we could and could not keep open. Because we certainly wanted to be in compliance. We have a small splash pad that's a part of our aquatic area, and that was determined to be a water park, and that was one of the things that was closed. So our lap pool could remain open for exercise. We've seen a tremendous uptick in swimming. I think a lot of people that were coming back and starting to use the fitness center have said, you know what, we can take a swim, and that's nice. Also, letting people sign up for things. And I know Chris had mentioned crowds, so everything is by reservation only, which is giving people a sense of comfort.
Definitely. And Art, we'll circle back to you. Have you had to do any sort of, talking with decision makers, in Whitefish or Montana?
Yeah, absolutely. I think that you quickly found out when the pandemic was really hitting in early March and things started to happen that our industry as a whole, whether for-profit, nonprofit, rec center, whatever, we didn't have lobbyists. We didn't have anybody that was in offices of influence and helping decisions being made, and we saw that right away. So in our small state of Montana, well, not small state, but not a lot of people here, we started getting together with organizations across our state and establishing our own alliances so that we could communicate with our governor's office and advocate for us as a essential business and how we could possibly get open sooner rather than later and develop those plans. And it really was integral in the fact that we were part of the second phase of opening for the state of Montana and putting all those protocols into place. So like Todd said, we had our 40-page document, with everything in it that we were doing to keep people safe. And we continued those conversations. There's a task force in our governor's office that includes fitness facilities. We continue to work with them in the hopes that we can become an essential business. If restrictions are given, if closures are looked at, I think that we're part of the solution, and we need to let people know that we're part of the solution, and that's the advocacy portion of that. And if there's going to be restrictions, keep us open, let us be part of that, and let our leaders know how we're going to do that. If anyone had the opportunity to watch the Club Solutions webinar yesterday with Brent and Bill McBride and all those folks, they talked a lot about advocating on that front. And as an example, I know that Washington has already started an alliance group, and they're working with the governor. And that's a great example of what we can do as an industry as a whole. So yes, we are, and we continue to do that.
Excellent. Well, Art, you actually touched a little bit on the elephant in the room that is possibly having to close again.
Yep.
I know that's not a pleasant thought, and I know nobody would ever want to do that, but it seems like the possibility of reclosing is becoming increasingly real in a lot of parts of the country. So, Chris, you can field this one first. You're our opening hitter. Has a possible closure of your facilities crossed your mind the past couple of weeks? And if so, how are you preparing for that possibility?
Yeah, it's absolutely crossed our mind, more so now than we've seen some of our peers and colleagues in different areas having to shut down. We see some things in Phoenix and California. And then I'm also reminded when I have some peer conversations that there's parts of the country that have not even opened yet, been closed since March. And so you feel a little bit guilty thinking about and being anxious about closing again when you hear somebody has never even been open. But it's a reality that we face, and I think a second closure would be even more challenging on our business, mostly because I think it's really painful for the staff. They're really struggling, and we're trying to find ways that if something happens in the future, that we can find ways to support our staff. We don't have the safety nets starting August 1st, like the $600 a week support from the federal government on unemployment. We don't have the 50-50 rule for self-employment. So this second time around could be really challenging. It's in everybody's interest to try not to have a second round and do what we can to protect from that. But we're having secondary planning conversations and preparing and be able to make decisions so we don't have to do it on the fly like we did the first time around because it snuck up on us.
Yeah, definitely. Todd, has a second second closure come across your planning meetings?
It has, and obviously it is not an appetizing thought. Closing the fitness center after we had gotten it reopened was really hard. I mean, I think to Chris's point, it was hard on our staff that had just come back and were getting started making personal training appointments and working on the floor. I have to say to them, unfortunately, this is the situation. So we're hoping to avoid that. We certainly are discussing our contingency plans if that happens. And I think that our desire would certainly be to be an essential provider of services to allow parents who are at work to stay at work, to watch their kids, to provide a space. We're looking at doing all-day programming at the J, where we'll, in a sense, supervise kids doing their online learning so parents can go to work, or even if they're working at home, don't have the difficulty of trying to be on their own Zoom call and watch their kids to make sure they're staying on target. So we're trying to expand the essential services that we offer in order to keep ourselves as open as we are able as we navigate through this, I'd say either extension of the first wave or second wave of the disease.
Art, what are your thoughts?
I love the supervising kids that are online learning. That's a great one, Todd. I'm making notes, of course, as these guys are talking too. Yeah, it's daunting to think. We have a playbook of opening, at least most of us do. And I don't know about Chris or Todd, but I had the fortune of being involved with other facilities to help me build that. what I've found is there's a lot of people out there, maybe people that are listening today, that don't have those resources or connections. And anything that we can do to put things out as a format, I think we should be doing, because we all need to be in this together. And yeah, we need to have a plan. As uncomfortable as that is, we need to be having discussions of what happens if we shut down. As Todd alluded to, what portions of our business can we keep open? Advocate to our leaders that we can keep those portions of our business open, and get that playbook, because if you're not planning and looking, you're going to be really, in a tough spot should a closure occur. So yeah, those things need to be happening. I'm trying to put my plan together now and work with people. So share what you can so we can all be prepared in the case that it does happen.
Definitely. Well, in your opinion, what are some of the best ways any facility can go, like what preventative steps can any facility take in this current climate to prevent a reclosure?
Well, in my opinion, you have to be doing what you should be doing right now, and you need to let people know what you're doing. And as part of that advocacy portion, I think, letting your local community know all the steps that we're taking. I think that if you look at recreation facilities, fitness facilities, in my opinion, in my observation, at least in our local area, is we are some of the cleanest businesses out there, and people need to know that, and hopefully that will help in when we implore people to be that essential business, to stay open. So people need to understand the steps that we're taking, which are extreme. I bet you if I looked at any one of your 40-page documents, it would be overwhelming, the steps that are being taken to stay clean and sanitized for our community. So I think that's huge.
Chris, same question.
Yeah, I was thinking about that, and I think one of the best things that's come out of COVID, which it's hard to say that good things have come out of COVID, but I think people everywhere at all levels owning cleanliness is really critical. We got to a point in society where it was the janitor's responsibility, or it was the cleaning crew's responsibility. It wasn't our responsibility, and I think that's reset society. That it's everybody's responsibility. It's my responsibility to keep my hands clean. It's my responsibility to make sure that things are clean and disinfected and all that. And it doesn't really matter whose job or what your title is. I think we've really owned it, and that's helped. And I think we've pushed that from day one, that everybody has to own this if we're going to make it happen. And we can't afford to triple the number of staff that we have on housekeeping when we're at 60 or 80% of our typical membership. So we need everybody to be doing that. And so that's probably the best thing that can happen, is if we can really encourage that. That's the new norm, guys. So you don't have the ability to get back to where we were and rely on somebody else. Everybody's got to wipe, everybody's got to clean, everybody's got to disinfect, and everybody's got to communicate when things aren't done appropriately. We have to hold our peers accountable, and we have to hold ourselves responsible all the way along.
Yeah, definitely. I don't know if you remember, Chris, but on a previous roundtable, you actually said a few times the exact phrase, cleaning is everybody's job. And we talked about getting a t-shirt made for with that on it. Still waiting to hear back from the t-shirt printing shop. They don't return my calls anymore.
I think they're sick of me saying it. Now hopefully I don't have to say it. It just is a part of everybody's life now. But I do think it's not just our staff, our members too. I mean, we really got to reinforce that it's everybody's responsibility, and it's a community effort.
Yeah. One of the words that I've thrown in, just to add to just a small snippet to Chris, because you couldn't have said it better, Chris. I agree with you 100%. One thing that we're using here is the word conspicuous. Make it conspicuous. Right. Let people know, that you're cleaning, where, obviously you have your uniform on, but make it conspicuous cleaning so that our members can see, because it's part marketing too, guys. We got to we have our members or our people, they need to feel safe. So just add to that.
You should tie a bell to each rag, so whenever somebody's wiping down equipment, you know what's happening. Todd, same question. Can you weigh in on this?
Yeah, I think what Chris and Art said for sure. The idea that we're all in this together. So everyone owns cleaning, and everyone's doing it, and we all are accountable to each other in terms of our own health and safety. And I've heard staff say to each other, do you think you should be doing that tonight after work? Because what you do after work with a group of people is going to come into the building the next day and potentially affect all of us. So this idea of really it's community. I mean, that's really what ends up happening is we're responsible for cleaning together. We're responsible for our health together. And what Art said earlier, I think, is another piece that's very much an outcome of this is that across this industry, we've all thought together about this. And the pandemic's been really difficult, but it's empowered us to have these kind of conversations where we're all learning from each other. We all started effectively at the same baseline, and we all needed each other. So I think that there has been a lot of that that has been of great benefit, where every voice does matter in a way that maybe it didn't before.
Yeah, definitely.
Well said.
Yeah. Yeah. So Todd, we'll stay with you. If in the event of a second shutdown, we've talked about how it would affect the staff and affect the procedures and the organization. How would you anticipate the membership reacting to a second shutdown, at least in your community? And depending on that, whatever reaction they have, how would you deal with, how would you handle the fallout from that?
So, in truth, I wouldn't have us take it personally if we had their frustration and the legitimate anger that they probably would feel. We retained 89% of our membership through the closure, but of that, about 200 units are still on hold. So that's part of that 89% calculus. And they're slowly starting to think about coming back. I think that if we were to close again, we're going to be agile and offer extended holds and try to do whatever we can. But I think people are just going to say, like, I can't. And I think that that's going to have a deleterious effect coming out of it, of the lack of confidence that reopening is really reopening, and reopening may mean closing again. So I think we should all do everything we can in order to stay open and stay open safely, to limit the number of people that are coming in, to be physically distanced while we're providing activity, to remain clean, and to advocate to whoever we can that what we're doing is making a difference, and we're doing it within the safest possible way in order to benefit the community. I think if people have to go back and be at home again, it's going to be really hard on everyone. People are going to need a place.
Yeah, definitely. Chris, can you weigh in on this?
Yeah, it really didn't hit home until earlier this week when I went to one of our Y branches to check on a capital project, and then after that, I was getting ready to work out, and one of the staff leans over and says, "Do you think we'll close again?" And she did that with a kind of a pain in her voice, and was like, "Ooh, I sure hope not." But what it reminded me of is that everybody across the board, members, staff, they're thinking about this. And so we got to really dig deep and figure out how we're going to communicate right now what we're planning for, so they build a level of trust and understanding that we've got it covered, and we have the capabilities of recovering through it. So yeah, I think that's kind of weighing on me heavy, and that's something that we're going to have to work on here in the next couple of weeks to try to make sure we have a game plan, but more importantly, that we've helped our members and our staff understand what that game plan is, and how we're supporting the community. For me, it's really important that we show all of the ways that we're supporting the community, and it's not just about lifting weights and running on a treadmill. We do so much more than that. That is trying to share those opportunities with people, how they can be mentally fit while being physically fit, while being spiritually fit. So all of those things really take into play, and if one's off, the other two are definitely off. So we have our work cut out for us in trying to come up with that game plan. But nobody's ready to make that game plan. It's nerve-wracking. It's scary. It's upsetting to even think about it. So it makes it even harder to do.
Yeah, absolutely. Well, and staying with you, Chris, you've mentioned, for example, delivering food at some of the local schools, each day, and sweating so much that your gloves have sweat pooling up in them, being out in the community, even though your facilities weren't open during a large portion of that time during the first shutdown. In the event of a second shutdown, you kind of have to go back to operating at a limited capacity. What do you think is the danger for the industry if the pandemic lasts longer than people think and organizations are having to operate at that capacity? What would be your game plan in that event? What are the challenges you could foresee?
Yeah, I can guarantee that we'll lose a good portion of our industry if that's the case, especially in the nonprofit. We've seen 25% of the general fitness industry across the board that's gone out of business. It's put right now it's not put a strain on the industry because we're operating at such a lower capacity. But as soon as we get back up to 100% capacity, it's going to put a tremendous amount of strain. And the new business development is going to come to a screeching halt because people aren't going to have the capital or the trust factor to be able to jump into those businesses. So I think we're at a crossroads. If we lose another round of this and we lose another 25% of the industry, we're going to be hurting. On top of that, there's organizations like all of ours that are not just fitness industry, but we're really supporting the community in so many ways. Healthy living, whether it be food service or supporting schools or doing after school programming or virtual learning support. Those things are things that the government necessarily can't do, and for-profit industry isn't doing it. We're really relying heavily on this nonprofit industry that's similar to JCCs and YMCAs and community centers to be able to provide these services. If services go away, what happens to kids, like I said earlier, that 5 days a week have to do school from home? And if their parents are in a service-related industry, they can't work from home. Well, what are those kids going to do? And then what is the societal effect 10 years down the road when those kids become adults? That's the part that I think we have to really hit home in this entire pandemic, is to think about that. Right now, our politicians and our community are thinking about college football starting in the fall. That's their biggest concern. My biggest concern is 10 years from now, when that 10-year-old hits adulthood and is ready to go into society, do they have the tools and resources in their toolbox that society and the community and organizations like the YMCA is building every day? And right now they do, but a second shutdown is going to be extremely painful for that environment. And it's not just an immediate need, an immediate challenge to our pocketbooks. It's a long-term societal issue that will be devastating if we don't do something about it and make sure these organizations stick around.
Yeah, Art, how are you and the wave, how are you guys bracing for, the continued impact of the pandemic moving forward?
Well, outside of our business operations and obviously trying to be fiscally smart in how we manage our money, I mean that's the number one thing. And if we shut down, if you don't have those kinds of resources, it's going to be real tough. Like Chris said, and you're going to have to look at the programs you're able to keep running. So I keep falling back to something that I say often is, we're nonprofit businesses. We're still a business. We have to look at those things and how can we keep our business running. And I think that you have to pivot quickly and we have to reinvent ourselves. So if you look at the bricks and mortar side of things, and if those are shut down, how can you possibly keep going? I think like the rest of the fitness industry, you have to look at virtual operations. How can you keep those types of functions still churning to help support the greater organization? So if you look at training virtually, if you look at group fitness, what are those kinds of things that you're able to offer? That's where a lot of our focus is right now, how can we still have a membership and have a revenue stream even though our bricks and mortar is shut down? And that's difficult, and those are the kinds of things that we're looking at right now. Obviously, looking at funding beyond our normal streams of revenue and in terms of writing grants and things like that. We've been doing that nonstop to try to get some of those funds put aside so that we can continue. We've been letting people know that we are extremely concerned about a next shutdown and that we need those types of resources in play now so that they can be fully operational should a shutdown happen. So that's kind of the second portion of what we've been doing, and putting those monies aside so, you know, hopefully we can still do it in some sense of manner. So even if our bricks and mortar are shut down, can we still, within our four walls, operate some of our swim lessons for kids if we're taking certain measures? It's not open to the public. We're doing it for, you know, for schools. So I'm just, you know, trying to stay nimble. I'm writing script as I go along here. There is no playbook, I think, is what Todd said.
Yeah, isn't that the truth? I think everybody's picking it up.
Yeah, if I can add something, I think one thing that we've really realized is that we have to rely on our community partners a lot. So we take a look at our strengths and what resources we still have available to us, and where we can bring in 1, 2, 3 other resources. And so that way each organization is reducing the number of resources they bring to the table, but you put those together and they become a pretty exceptional community resource. So we're doing a lot of that, trying to find ways where we can hook up with school districts and nonprofits and for-profit businesses to provide these services the best that we can.
Absolutely. Yeah. Todd, would you like to jump in on this topic?
I think Art and Chris said it all. I was going to add the piece about the value of collaboration. So I think that's the secret, is together. When we work together, we're not giving up power, we're gaining strength, and we have to take that approach today.
Yeah, absolutely. Well, you actually, Todd, we'll stay with you. It was mentioned before, you know, finding money right now. You know, it's kind of tough. Can you offer any tips for, you know, where to find the funds to still be able to operate even at a limited capacity?
So certainly individual giving and making a case of impact to individual donors in the community is an approach that we've taken. But we also, when we shut down, we actually hired a grant writer. We engaged with someone and said, you know, things are tight, and we've released a whole bunch of people, but we need to find foundation money. And within the first month, she more than paid for herself, and we've slowly started to get some $5,000 and $10,000 grants, and those are helpful because they're going to help us keep specific programs in play. And we made the decision we're going to actually keep her on for the long term right now, because the donor community in any community is being asked by a multitude of nonprofits. These foundations and grant opportunities are in business, if you will, in order to fund certain levels of impact, certain levels of programming, and certain services. We've gotten some facility type grants as well as some program type grants. So I think that's a really important, we felt that was a really important strategy to take, to invest a little bit of money with a high opportunity of return without going to our members then, or to our donor base.
Okay. Chris, do you have any, you know, fundraising or fund finding tips?
Yeah, Todd did a great job. I'd add that proactive communication is really critical and vital, and it's led to some gifts that were unexpected. So we've been really forthright with our financial situation and what successes we've had, and we communicate that with every large donor organization in the community. And out of that, we're starting to see much more concern and much more understanding about the essential services that we provide. And we've had some foundations reach out and say, we want to help you. We understand your need, and you're a vital piece of the community. And so without even asking them directly for dollars, just by communicating and keeping them abreast of our situation, we've had some success in addition to the grant writing. And then, Todd, we just extended our grant writer by 6 months. We have a 1-year contract, and we gave him an extra 6 months because we think it's so important. and they've been really vital in the last few months. I think we've had $270,000 worth of grants just for COVID relief, and we have $1 million worth of asks out currently that we should know in the next 10 days whether those come in. So those are really critical at a time when we've been reduced probably $5 or $6 million in revenue.
Art, do you have any fundraising or fund finding tips?
I don't think that I'm going to bring much more to the table. We too have been writing. There's a lot of opportunities, I think, at our state level. So I don't know what kind of state, each person may have opportunities just within their state, and looking at what opportunities exist there. We too have a grant writing function within our facility operations, and we've increased that as well. So that's a great tip that Todd put out there. I think you need to invest to earn those dollars, and if you don't do that, I think you're going to be in trouble. So yeah.
Excellent. Well, shifting gears just a little bit, but still focusing on the idea of possibly reclosing. And Chris, I'll go back to you for this, because you mentioned the staff member who asked you if you were going to have to close again, and it really does break your heart. And thinking about that, possibility, are there any tips you can offer, or have there been any ways you've been keeping staff morale up in this uncertain time?
Yeah, it's it's a topic of our agenda, culture, strategy and culture agenda constantly. It's more of a topic now. A couple of things we've done is we've focused on divvying up the responsibility of kind of keeping spirits up and then checking in on people. With 1,500 employees, it adds up. So we continue to do things like birthday cards and anniversary cards, personal notes, phone calls. We early on we did Zoom happy hours. I think we talked about that in the last webinar. I've enjoyed those. We strategize on what those topics can be. They first started out just for fun, just to connect, because we couldn't get in person, and then we started having topics about equity and inclusion, and trying to make sure that all voices were heard throughout the organization on many topics, not just COVID. Our staff get tired of talking about COVID too. So we're looking for ways where they can continue to drive the organization forward, because they don't have those opportunities right now in person. We don't have the all staff meetings, and we don't have the special events that we normally have where we bring people together. So I think that's really important, that we find ways to give all staff the opportunity to talk about the business and what we're doing, and how do we help the members, and how can they be involved in the decision-making process, and then how do we reward them when we hear things are going well. In my area, we have 10 branches, and because of COVID, our senior leaders are not jumping from branch to branch like we normally do to check in and see them in person, because we don't want to be spreading germs and viruses from place to place. So that's the other thing, is trying to find ways to check in on that staff, whether it be Zoom meetings or phone calls or notes of appreciation. We don't get to catch people doing really good things on a daily basis. So we got to figure out how to catch those people doing well. So it's important that our execs are articulating what they're seeing, so that we can continue to reward them.
Art, how are you keeping staff morale high?
Well, I think we've certainly had our cyclical morale issues here. Just a similar conversation to what Chris noted. People know it's tough, and I think one of the most important things you can do is be present. I was listening to Brent Darden the other day. He shared 3 things, the 3 Ps. I think it was be present, number 1. So be on the front lines as much as you can, and some of us can and some of us can't. But being out there is huge, and to remain positive is when you are out. I think we tend to, as leaders, we'll be in our office and we're making difficult decisions budgetarily, staff-wise, reducing and all of that. But when we walk out of our office door, we're on stage. And it doesn't matter how you look at your position, you are someone that people are looking at. And if you're visibly not positive with your demeanor and all of that, that has a big impact on morale. So being optimistic, no matter what the situation is, and being positive is huge. And I think that has a direct impact on on the whole morale. And obviously planning, I think that if you take that other P and you plan and you have a good plan and people know it, then that's going to help as well. Now, some simple things that were shared here recently. We talked about Lisa Gorsline at the Corpus Christi Athletic Club, and she is a huge cheerleader. I took those, and I'm not personally a great cheerleader, but I found 3 people in my organization that are, and I let them go. And they're doing great things. I just got a box of candies I'm looking at right here, and as an example, this one's thank you for choosing a good attitude. It's a pack of gum. I think things like that are simple to do, and they'll make a big difference. They're putting in t-shirt days and flip-flop days and things like that just to keep the spirits high. So those are some things that we're doing.
Excellent. Todd, same question.
I have nothing to add to what Art just brought. That's phenomenal. I think it's using ourselves really intentionally, being present, being out there, being willing to listen. We have every Friday afternoon, we have a Zoom for whomever wants to join in, to be able to kind of end the week together. And that's been really nice. And I've been really pleased as to the number of people that keep coming on that and just feel this sense of closure to the work week, if you will. And we do it before the Jewish Sabbath, so that it's got a little bit of a spiritual aspect to it. And it just sets the tone nicely for people, and people feel good going into the weekend. Again, I hate to keep using Zoom, but once a month I do 3 separate open calls for staff, anyone that wants to come in. And we're also working, candidly with the counseling agency to make themselves available to be a resource for staff, to have a direct and open line if they just need a little help and support outside of what we can provide. This is not just at work. This is at home. This is going to the grocery store. And we wanted to make sure that our staff knew that we helped facilitate a little extra help, because we're always concerned about the physical health and all of those things. But making sure that we care for people's mental health is really important.
Yes, absolutely. Well, gentlemen, that was about all the time we have for today. To everyone listening, I hope we were able to provide some actionable insights and some good tools to adapt for the future of the industry. I want to thank Lebert Fitness for sponsoring today's roundtable, and I want to thank each of our panelists for their time and their perspective today. It's been truly valuable. I hope everybody has a great rest of their week, and we'll see you next time. Thank you.